Hi friends, let's talk about the truth about the heart stents that every patient should know. So have you been told that you have a heart blockage? Or has one of your family friends been told they have a heart blockage? And are you wondering if a stent needs to be placed or not? Let's talk about this. So friends, most people believe that if there is a blockage in the heart blood vessels called coronary vessels, it needs to be fixed with a stent. And that is simply not true. Let me explain. I am Dr. Toishi Sharma, Interventional Cardiologist, and I'm here to talk about when stents can be helpful and when they are simply not required. First of all, let's talk about when is a stent absolutely required. A stent is absolutely required when someone has a major heart attack, especially an ST elevation MI. In this condition, a blood vessel is 100% occluded, and we try to open up the vessel as soon as possible, most of the times with a stent, so that we can restore the blood flow back to the heart muscle and save the muscle from dying permanently and causing reduction in the pumping function of your heart over long term. Having a heart attack is usually a clear-cut indication to have a stent placed. There are some caveats to that. If someone is found to have multiple blockages during a heart attack and if CT surgery is available, then we may refer you to urgent CT surgery as well instead of a stent. Secondly, it has to be technically possible. Sometimes a heart attack can be caused by a very small blood vessel. And in these cases, it will be very challenging to put a stent in because our smallest stent is 2.25 millimeter. But if a blood vessel is smaller than that, we cannot technically go and put a stent in it. So that may be a limiting factor. Another issue can be that heart attacks can be caused by something other than a blockage. For example, there can be something called SCAD or spontaneous coronary artery dissection. In these cases, there's a tear in the blood vessel and not an actual clot that causes a heart attack. So in this situation, we do not put a stent in. A second situation where your doctor may tell you you had a heart attack could be stress cardiomyopathy, which is known as broken heart syndrome, meaning your blood test will be positive for troponin, but we do not find any blockages to fix with stents. And thirdly, there is a type of heart attack called NSTEMI type 2. What that basically means is that your blood test was positive for troponin, which reflects injury to the heart muscle, but it was because of something else happening in the body and your heart being stressed out because of that. For example, if someone has pneumonia or urinary tract infection or fever because of something else, then the heart can get stressed out because of it and you may see a blood test positive for troponin. But it is not a primary problem of a blockage inside the heart blood vessel called coronary vessel. So, in this situation, even though the doctor may tell you you had a heart attack, they will tell you we did not need to place a stent. So, we talked about the fact that if someone has a true heart attack where there is a clot in the blood vessel, we try to put a stent in most cases. Now let's talk about a situation where there is a blockage in the blood vessel, but the person is not having a heart attack. So, if the person is having stable symptoms, meaning they have a blockage, but they only have chest pain or shortness of breath when they are exerting themselves, and the pain goes away when they are resting, it means they have stable symptoms. The plaque has not ruptured or caused a heart attack. In this situation, we have to evaluate a few things. The first and the foremost thing is, how bad is the blockage? If the blockage is mild, meaning less than 50%, it can be treated just with medications like aspirin, statin, and beta blocker. In fact, mild blockages less than 50% are not enough to cause chest pain in most cases, and therefore it is possible that your symptoms may be because of something else other than the heart. The second possibility is that there is a moderate blockage. Moderate blockage is anywhere from 50 to 70%. This is a tricky one, friends, because when there is a moderate blockage, there is a chance that it is significantly reducing the blood flow to your myocardium or heart muscle, But there is also a chance that it may not be reducing blood flow to your heart muscle. So to break this tie, we do a further testing called FFR in the cath lab. This tells us if that moderate blockage is physiologically significant or not. If it is not significant, then we treat it just with medications. And if it is significant, then we treat it like a significant blockage. Now let's talk about significant blockage. Anything 70 or more than 70% is a significant blockage in the blood vessel. Now, if a person is having stable symptoms and they are found to have a significant blockage, which is more than 70%, then we again have to look at two things. Where is the blockage located? If the blockage is located in left main or proximal LAD, then we try to do something about it right away with stents or surgery. And that is because these vessels are supplying a large part of the myocardium. But if the blockage is in other artery like right coronary artery or circumflex artery or distal part of LAD, then in that case we first treat with medications alone, because large trials have shown that putting stents is not necessarily beneficial in these cases, because medications work just as well and they do not come with the risks of invasive procedures. So if there is a significant blockage in right coronary artery, circumflex or distal LAD, we give medications like aspirin, statin, beta blocker like we would do in mild disease, but we also give additional medications like anti-anginals, which will help to dilate those blood vessels to increase the blood flow. And they will also reduce the amount of oxygen that your heart muscle requires. These are medications like amlodipine, ranolazine, Imdor, and so on. If you do not get complete relief of your symptoms within a few weeks of these medications, then even patients who are having stable symptoms are eligible candidates for receiving a stent. So friends, this is how, as interventional cardiologists, we look at any blockage. We see how the patient is presenting. Are they presenting with heart attack or not? And secondly, we look at how severe or significant is the blockage. Is it mild, moderate, or severe? And thirdly, we look at where is the blockage located. And lastly, we look at is it technically possible to fix the blockage with our equipment, because sometimes if the artery is too small or too tortuous or extremely calcified, the risks of doing a stent procedure may be higher than the benefit. So every case is unique. We do a detailed discussion with the patient, examine them, review their images, and then come up with the best plan for every patient. So I hope you found this video helpful, and if you have any further questions for me, please comment in the section. Don't forget to like and subscribe. Thank you.